This past year, we experienced a once-in-a-lifetime event that will be etched in history forever. As we all recover and try our best to get on with our lives in the pandemic, some people are just starting theirs. In this segment, we'll be going over how hospitals have redone their protocols for treating patients, more specifically mothers who are about to give birth. So I interviewed some nurses to share with us their experience. This is Born in the Pandemic.
I work on postpartum, but I also do nursery, so sometimes if I'm in the nursery, I get to see the whole birth process and go and take care of the baby at delivery.
I work on the mom-baby unit, and so I come to work and I get my report on two to three couplets, which is 4 to 6 patients. I get my report and then I care for these patients on a 12-hour shift.
Also, sometimes I'm in postpartum, which is the next step, and they get to go over in the recovery side and learn everything about taking care of the baby.
Teach them about safe sleep habits, breastfeeding, bottle feeding, frequency of feeding, swaddling, all of that.
We do a full assessment on the mom and the baby and the vitals. We make sure that everything's good with their labs, basically just the overall picture from birth to when they get to go home.
On top of everything, whenever we come to work, we have to wear a mask.
They added masks for the whole shift. You have to wear them for you and the patients. They also added temperature checks for when you get there, so every single person needed to be screened when they got to the hospital, so all the staff and all the patients.
I have cared for patients with COVID, and whenever a patient is positive with COVID, they are in a negative pressure isolation room, and then I have to put on all the different PPE before I go into the room. And then if the mom is positive, the baby can stay in the room with the mom, and then the baby, everything gets done in the room.
At first we were asking the mom if she wanted to be separated from the baby or if she wanted to keep the baby with her. A lot of the moms chose to keep the baby in the room with them. So with that, we were able to test the baby at 24 hours and 48 hours to see if they got infected. And we actually didn't have any babies that were infected by COVID. If they did choose to be separated from the baby, we would keep the baby in isolation so that it didn't infect any of the other babies and it couldn't go into the nursery.
I truly love having the siblings and family members. I love having them there at such a special, sweet time as the birth and just the birth of a newborn, and it's so exciting. So I love having the family there, and so that's been a change. And then wearing a mask obviously has been a change. And so overall, though, I like to be positive, and it's not been too bad for me.
It overall hasn't been too difficult, but mostly the major changes were no visitors, so none of the brothers or sisters could come see the new baby, none of the grandparents could come see the new baby. With wearing your mask, you can't see your patient's expression and they can't see yours, so that kind of takes that away a little bit. You can't see when they're smiling as much, or when they're in pain, you can't see all of that, so that just kind of took away that a little bit. I definitely feel fulfilled in my job. I love it so much. It's so fun. It's definitely my passion. I just look forward to going to work. It's amazing. I love being able to teach all these new moms and dads about how to take care of their new baby and how to feed them and change them and everything. It's just really fun, so I love it.
I see coming to work as a mission field. I'm caring for people and serving people in this spot, in this space, and that's how I see it, and that's my encouragement for coming to work.
Even with the challenges that new families and nurses face, perseverance and hope for the future will always outshine the shadow of turmoil. As a great man once said, life finds a way.